All right, so let's dive right in. When I heard we were talking about technology and healthcare, I feel like there are two ends of the spectrum, which is there's a lot of exciting stuff going on in healthcare technology, but on the other side, I feel like a lot of people in this room probably experience, you go to the doctor's office and they want you to fax in a health record or something, and so I guess maybe I'd start with Gulshan. How do we kind of bridge that gap so that, in the daily average person's experience with the medical system, they are getting the benefits of the technology, and it's actually, filtering down not into some separate compartment, but it's, something that everyday people are experiencing?
Yeah, thank you again for having me here. I'll contextualize a little bit about my role, just so I can answer this question from a couple of different perspectives.
Yeah.
So I head the Bayer Institute for Health Innovation. It is a collaboration between Children's National Hospital, an eminent pediatric organization out here in the DC area, and then Oracle, which is, Cerner Corporation, just got acquired by Oracle, a leader in terms of healthcare and innovation and such. Sitting at that crossroad of health and technology, myself and my team, we get a chance to get a unique perspective on some of the challenges that have existed over the course of the last decade and a half in terms of digitization of the health record, but now being able to go out and bring more utility to all the hard work that has actually taken place. The promise is significant as we start looking at the ability to go out and utilize health technology in a way where the organizations can have more equitable use of it for all those that depend upon it, whether it's the caregivers or the patients and the families. I think that is really upon us right now. So the access to technology and the ability for technology to go out and deliver on some of that promise has made a tremendous amount of advance over the period of time. Now it's really a question of being able to go out and have the means for everyone to be able to utilize it in a way where there can be actually meaningful outcomes as a result of it. So being able to go out and have the ability for patients and families to interact with their caregivers on an ongoing basis, being able to go out and get insights based off of the data that exists as part of that, that is right now upon us, and we are able to go out and engage with those from a pediatric population perspective. So several examples that I'm happy to go out and share, but in general, I think, right now, the real limitation more than anything else is not the technology and the advances, but more in terms of the adoption and the equitable adoption of that sort of technology that can actually go out and benefit the larger community in general.
Yeah, so Dr. Lisa, to get into that access question, maybe talk about how you're using technology in terms of health literacy, especially in underserved communities. How are you kind of using that?
Good morning, and thanks for having us here. So I'm the founder of Grapevine Health, and the reason our company is called Grapevine Health is because that's how people often get their health information. I mean, just think about how often you or even any of you contact someone you know after leaving the doctor's office to get verification that the information is true. And how are you doing that? Most of the time you're sending a text message or you're calling someone. So we focus on what people know, how they're receiving information, how they decide they trust the information, and what they want to do with their smart devices or their mobile phones. So we create content that we push to people digitally, whether it's on social media, and we're building a platform that allows them to ask us questions, but also send them answers in the form of video. And that's really important because we focus primarily on the Medicaid population and underserved communities. And I think there's a bit of a false narrative about the digital divide, which says, well, if you're poor, or if you live in an underserved community because you don't have broadband, we can't serve you. And actually, that's not true at all. Because during the pandemic, we were able to communicate with people in a variety of ways, clinically or just for information, particularly related to the vaccine, just using the internet. They're on Zoom. They're able to get on the internet. They're able to send messages with the devices they have. So a lot of our work is also to shine a light on how you can still support people digitally if they don't have the best access in the world, the fanciest access, but can we provide support for them with the technology they have?
So maybe to build off the effect of COVID, how has that, some people here say, that sort of almost sped up some of the technological changes. I mean, for either of you, do you agree with that? I mean, are we seeing these telehealth changes, for example, are going to be lasting? How has COVID kind of changed it, or has it?
Yeah, so I think it's the often repeated cliche about the silver lining from the pandemic has been the adoption of telehealth, being able to go out and make care more accessible where the individual is that requires it or that necessitates the care, and so on and so forth. I think there's literature out there that talks a little bit about the digital divide on both sides of the spectrum, talking about how much of that was actually truly equitable versus not, depending on, being able to go out and truly utilize something like this. However, in general, I think the ability to be able to use something like telemedicine and building upon it was actually proven out through the pandemic. There's also a greater recognition of being able to understand the population better, beyond just the clinical care that is delivered, especially through telehealth and such, where you get a chance to go out and see the individual, see the patient and their family in their own setting to a certain extent, and that goes out and brings in the social element of care delivery, the behavioral side of things, and everything else that go out and influence some of those decisions that are needed in order to go out and truly treat the patient and such. So, being able to go out and now start recognizing the importance of it. Some of the things that from a Children's National perspective is like being able to use geospatial modeling to be able to understand where the population is, what the demographic makeup of it is, what are some of the community-related benefits or lack thereof that are available associated with the patient population based on who you're going out and seeing, being able to consume the data associated with some of those demographics, and being able to go out and incorporate that into the care delivery processes, and then hopefully building the platform in the future for being able to go out and utilize that in a little bit more of a predictive manner to influence health and care outcomes. I think there was a study that was done from a NHS perspective that I've seen some reports of more recently about, individuals with learning disabilities were 6 times more likely to be hospitalized from the flu, and being able to go out and incorporate some of those data elements, being able to have pop-up flu clinics that go out and address those disparities to a certain extent, are actual, real examples of the health outcomes that use of technology and analytics have actually been able to go out and benefit from.
Mm-hmm. And yeah, Dr. Lisa, I mean, we were talking earlier, maybe it just kind of exposed some things that already existed.
I hope we're not getting
also.
the hook.
Oh.
Okay. I think there are a lot of ways to talk about the lessons we learned with respect to technology and the pandemic. And since we have such short time today, I'll just give an example. There's a perception that seniors are not good at technology, they're not interested in using it. And I learned a lot from one interaction. This was a woman, we started with a telehealth visit. Someone from her family had to show her how to use her iPad. Mm-hmm. But when I got to talk to her on the iPad, I realized I actually needed to go to her house. Mm-hmm. So I made a home visit to see her, and she was having some lung issues. And as I was leaving, I said to her, I'm going to leave with you a pulse oximeter. And I showed her how to use it. And I said, I want you to check your oxygen, every so many hours. And then I want you to send me a text message, because she had an iPhone. Mm-hmm. So I said, can I see your phone? Because I wanted to see how she interacted with the phone. She said, well, I won't be able to send you a text message because my phone is broken. Mm. And I said, what's wrong with your phone? She said, I lost my password. I forgot my password. So in that one interaction, not only did I get to understand what it takes to get her to use or to engage in a telemedicine visit, but going to her house gave me a lot of information about the support she had, what she needed. But then that digital literacy piece associated with something as simple as how do I use my phone? Thinking her phone is broken because she doesn't know her password.
Right.
So I think this is also a focus for Grapevine Health. How do we help seniors and other people who are not as proficient with the phone maximize the use of that phone or their technology for healthcare? And so the pandemic gave us many examples like that. And it was very humbling because we take a lot for granted about who wants to do what, how people use technology, where they get information. And so it was just really a fascinating and interesting time for us to learn not just about technology, but just about humanity in healthcare.
Great.
Yeah. What's for each of you, what's one thing going forward that you're most excited about in terms of healthcare technology, or the use of it, or the way it's being changed? What are you most excited about going forward?
I'll go first. So I think one of the elements that I am looking forward to seeing realized to a certain extent. We've talked about artificial intelligence for several years and such, and augmented intelligence and whatever you want to go out and kind of call it in general, right? But it's basically the ability to not have to predefine or pre-code the way that improvement can actually happen. There are machine learning and deep learning capabilities that are enabled through the use of the infrastructure that's there, the accumulation of data in general to go out and allow for that. One of those areas that we've seen being very successful outside of healthcare, within the retail space especially, is being able to go out and influence consumer behavior and being able to go out and get them to the right place that they need to. Just the success rate and the conversion rate are noted as being extremely high. Now, compared to other industries in general that are still on the adoption curve for this. On the healthcare side, similarly within that CRM side of things, or just the initial being able to go out and enable the access and engagement of technology, I think there is a great amount of utility that is perhaps a little undertapped. And we need to be able to go out and probably prove out a few use cases that I think will actually enable that. So being able to go out and understand what the consumer would need before, and being able to go out and direct them to the point of maximum impact from a clinician perspective would be extraordinary. There are lots of similar sort of use cases on the utility and the outcome side of things as well, but I know that those have probably been documented a whole lot more recently. Those are also ones I'm excited about. And doing it in the appropriate and ethical manner and so on and so forth. But just on the engage and access side of things, being able to go out and do that, I think there's a lot of untapped potential there.
Got it.
What I'm really excited about is noticing that this is the time when people are focused on health information. They are intensely trying to find information they trust, and that's our sweet spot. So this is a great time for the work we're doing at Grapevine Health. And I think because people are using their smartphones and their technology to consume health information and find health information, we need to put information out there that they want to interact with and engage with. Because if you think about it, the information you get from your insurance company or doctor's office, it's pretty dry. And actually, most of the content on YouTube is pretty dry when it comes to medical information, science, research. So I think the future of healthcare, it's not just mobile, but it's also helping people and directing people to the information they want and need, when they need it, and how they want it. So I'm really excited. And if any of you are not following Grapevine Health, we would love your feedback about how we can do better.
Yeah. Well, I think that's a good note to end on. Unfortunately, we're out of time, so thank you both.
Thank you.